Happy to introduce the panel. Jason Vitale, who is Associate Director of Cyber Investigations, Kivu Consulting. Jason is one of the individuals that I will go to as a breach coach and ask him to get involved initially on a scoping call and then to work with me and the client with regard to incident response. So he plays a very important role, but also a very unique role in that he leads the forensic effort with regard to incident response. Tom Scott is also with us today. He's ICEO, founder, New Century Solutions, LLC, leading its NCS cyber division. And don't let that fool you. You need to look at Tom Scott's bio, as with everyone else. It is extremely impressive. He has worked as a CISO in the cyber landscape for a very long time, and certainly has expertise and experience to share with us today with regard to his experiences in-house as a CISO. And then we have Kelly Geary, who is Managing Principal, National Practice Leader, Executive in Cyber Risk with Epic Insurance Brokers. I wanted Kelly to join us because insurance is extremely important in this landscape. You always hear breach coaches and others talk about transferring the risk to a cyber liability policy of insurance, and hopefully by now people know to do that. And they know to go to people like Kelly to find out about the cyber liability insurance market, the new developments. Kelly is on this program today because the market is changing and it's being driven by the ransomware attacks that we read about on a daily basis. So she has some very important information to share with us today. Maybe you can use that as leaders in healthcare to drive your decision making. So I just want to start off about the cybersecurity threat landscape. Cybersecurity has really become the wild, wild west of the internet. The bad guys like these in this picture really don't need to rob banks anymore. They're monetizing information from the comfort of their home, stealing the new oil of the 21st century, the personally identifiable information, the protected health information for you all who are on this phone, intellectual property, and they're monetizing it. And if they're not stealing it from you, because that might be the old model, they're actually extorting it from you. And later on, we'll talk about even how that ransomware model has evolved over a very short period of time. So I always found this cartoon to be appropriate. Healthcare, unfortunately, is the #1 target. Cyber criminals are still targeting healthcare. I think at one point in time, they promised during the COVID-19 pandemic that they would basically take a hands-off approach with regard to healthcare. But we have all learned, and the stats have shown, that they obviously, as a cyber criminal, they didn't hold true to their world. These are to their word. These are just a couple of different types of attacks that we've been seeing. Everyone on this call has been seeing. But you see ransomware highlighted in red because, as we'll discuss today, it really is the top type of attack that's going on out there. It's a debilitating attack. Maybe 4,000 of these attacks are happening on a daily basis. Every 11 seconds, these attacks are taking place. So now back to my forensic expert, Jason. In layman's term, Jason, we have a lot of leaders in healthcare on this line wanting to know about the threat landscape. I've already identified ransomware as a top type of attack that everyone seems to be experiencing. What is ransomware? Could you explain it?
Yeah, so thank you very much, Karen. So ransomware is the result of an unauthorized attacker essentially getting into and compromising a network or a device within the network and being able to deploy malware, which does essentially shut the user out of that data. So puts it in a state in which they can't use it. The goal of ransomware being the monetary aspect to it, looking to monetize by having someone pay to then be able to decrypt and get their data back.
So are we seeing themes with regard to these ransomware attacks?
Say that again?
Are we seeing certain themes with regard to the ransomware attacks and the ransom demands that people are finding on their computer screens when they come into the office?
Yeah, definitely. There's been a trend. So even, a year and a half ago, the ransom demands were a lot lower than what we're starting to see now and have been seeing for the past year. We'll get into numbers in a little bit as we talk through this investigation or the ransomware landscape. But obviously, they are starting to also implement deadlines. We see that on one of the bullets of this slide. So they're putting more pressure on our clients and their victims to really push them to pay. The other thing that we'll talk about as we move through this is the threat of exfiltration and how that comes into play as another way for them to monetize the data, even for those clients who may have backups. Whereas a year and a half ago, we would not see that incident occurring.
And one of the things I want to mention during this program is the deadline issue. And I know, Jason, that's something that forensics and I will usually ask right away when you get that initial call that, they see something on their screen, they're locked down, there's a message. We always say to them, don't click on anything, don't start a clock, running, because it certainly puts you in a very dangerous situation, possibly seeing the ransom amounts increasing over time. Have you seen that a lot?
More and more common, definitely. So in representation to that, we do see timelines anywhere from 3 to 7 days, depending on the ransomware variant that has impacted the client. Depends on how liable it is or how likely it is, the attacker will hold to that timeline. So for example, DarkSide usually sets up anywhere from a 3 to a 7 day timeline. They will hold to that timeline and they will push on it very heavily. Whereas a different variant like Sodinokibi may implement that 7 day timeline, but if you're actively engaged in discussions with them, there may be a little bit of wiggle room in that. Obviously, the goal of this is to monetize it.
Right. And I think we'll learn later on about the different types of strains and why it's important to understand what you're dealing with. So this next slide basically shows you some of the things that pop up on your workforce's screen, or even on your screen. This is just a sample. Just recently, another group released some recent stats. Believe it or not, the average ransom payment decreased 34%. From 233,000 in Q3 to 154,000. Now, I want to make sure that everyone on this program doesn't conclude from these stats that things are getting better and they don't have to pay attention to security and a layered defense approach. There's a reason why these stats are changing a little bit. And based upon the report, it's because, people are getting a little bit braver with regard to responding to these ransom demands. They're having different options that they can explore. As Jason mentioned, these cyber criminals are looking to monetize, and the quicker they can get their hands on the money, the better. So, some people are saying enough and choosing not to pay. It's a decision that we'll explore a little bit later, but certainly that's a good sign. 70% of ransomware attacks involve the threat to leak exfiltrated data. We'll talk about the double extortion model in a second, but take a look at email phishing as the top attack vector. Tom, as a CISO, I'm sure that you have expressed to your workforces that it's very important for them to be able to spot a phishing email. It's very important to have simulated phishing exercises in the workplace. How does that stat look to you when you find out that it is the email phishing that starts one of these attacks?
But Karen, I think the key here is that we know that's the top vector, and we know that our human firewall is really where we need to devote our time and our energy. At South Carolina's Medicaid agency, we started a 18-month phishing campaign. We did first month and we were at 17%. Second month, we drove it down to 13%. And months 3, 4, and 5, we're sitting at 9 point something, just under 10%. I'd like to get that closer to 5, but we've seen a significant level of improvement. I will share with you the best quotes I ever heard, Karen, was at the U.S. last year. when Clint Walker, the cybersecurity advisor for Homeland Security, showed up to work drunk.
We're
And
losing.
then,
Go ahead, Tom.
I'm sorry, Karen. Just go ahead, Karen.
Okay, did we lose Tom? Is he with us?
I'm still talking, I think.
Connection's a little scratchy.
Yeah.
Right. Go ahead and I'll try and reconnect.
Okay, all right, that's fine. So Tom makes a very good point. This is something that's constant. You all know that. Most of the people on this program know that being able to train your workforce on how to spot a phishing email and quite frankly, holding them accountable is key to reducing your risk. Additional ransomware stats, and the only reason why we have them in this program is that these just came out. So I think it's very important to understand what the landscape looks like. These are the top ransomware types: Soden, as Jason just mentioned, eGrogo, and Ryuk. Unfortunately, healthcare is still the #1 industry targeted by ransomware. And as you see, I mentioned the fact that they promised not to attack healthcare during the COVID crisis, but obviously they have. This is just an alphabet soup list of some of the ransomware strains that we have seen over time out there. They all have a different story behind them. Some of them started with just the extortion type of attack to get money, and some of them have now evolved to the point, as Jason mentioned, they're dropping the malware, and then later exfiltrating and detonating the ransomware, which has created some big problems out there. So Kelly, Tom, and Jason, I mean, what are your thoughts in terms of why these threat actors are still using ransomware and why they haven't been shut down?
Because they keep getting paid.
That's usually what drives it, right?
It's a successful business model, if you think about it.
Incredibly successful, right? It's an incredibly lucrative business model. I think that's until we find a way around that, I think it will continue. I don't know what everyone else thinks.
I agree.
Yeah, I'd completely agree with that. And we look for, like you saw in the stats prior with phishing emails and RDP being potentially low-hanging fruit available. Without measures in place to mitigate that, it is the easy target for easy money.
Yeah, I think one of the things that are really worrying people today are the commoditization of malware. There's so many different threat actors that can be involved in attack. It could start with one threat actor actually, gaining access and then selling that access to another threat actor who ends up dropping the ransomware. So, these attacks have gotten more sophisticated. There are more people involved in them. Do-it-yourself ransomware kits, you can buy them for $50 on the dark web, and you don't have to be a techie in order to start one of these attacks. We mentioned earlier the evolving nature of these types of attacks. The old model basically was, you have crown jewels, you have something that's very valuable. I'm going to steal it from you and sell it on the dark net. I represented an engineering firm once who wanted to know all about cybersecurity. And so I went in to meet with the key stakeholders, and we discussed cybersecurity. And the engineering firm, who was a big firm, who had a lot of the major projects in New Jersey and New York, thought that maybe I was scaring them a little bit about cybersecurity. And they did not think that they certainly, could be attacked because they didn't have, quote, the crown jewels. They didn't have anything that an attacker may want. And obviously they do, because all they need to do is be shut down, and that project, the bridge, the tunnel, whatever they're working on, may come to a standstill. So I think we finally got him to understand that cybersecurity was important. This is just an example of the crown jewels. Tom, Jason, Kelly, are you seeing anything in terms of attacks involving biometric data, since that's now become part of personally identifiable information? I
have not seen any specific to biometric. I don't know, like targeting biometric data. I don't know if Jason or Tom had.
I can't say I've seen specifically targeting biometric data, but once again, we talk about availability of data being a key element to this. If it is there and it is available and there is the time and availability to exfiltrate, that data is then at risk.
Right. And the reason why I mentioned biometric data is because some of the privacy laws are changing. The definition of personally identifiable information is broadened to the point that biometric data is now included. Interesting stat here, China has been engaged in massive data mining for years and has stolen personal information on nearly half of the entire US population. From the old model to the new model, when we're looking at extortion, as Jason said, taking away the availability of your data and your customers' data, and now the double extortion. And this is really what everyone should be focusing on, where they come in, they drop the malware, they exfiltrate the information that they already know is very, very valuable, because that's what's going to drive their demand for the ransom, and then they publish. So I know Kelly is probably cringing when we talk about this double extortion model, and so is Tom, and Jason is just challenged by it. He can't wait to get his hands on it. But it's really creating problems out there, because sometimes you don't even find out that your data is out there published or auctioned off and sitting on a wall of shame. Kelly, you told me the story about a plastic surgery group. Why don't you share that with the audience?
Yeah, this is a frightening one. So there was a plastic surgery physician group that was hacked, and there were about 3,000 or so current or former patients' information that was impacted. Obviously, there was a demand made on the physician group, a ransom demand made to the physician group. At some point in the process where they were negotiating with the cyber criminals, the cyber criminals became frustrated and perhaps unsatisfied with the back and forth with the physician group itself, and started to reach out to patients. And actually demand ransom from individual patients. Apparently, they've reached out to somewhere between 15 and 20 patients to try to get additional amounts from them as well. So it's a sort of a frightening trend. I don't know if, Jason, you've seen that with any, to any great degree, but that's sort of the first time I've seen that, but it's not surprising.
Yeah, to that point, that is definitely a threat we see the attackers take. We have seen instances where board members or C-suites will be getting phone calls or emails indicating, yeah, we have your data, right? How much is it worth to you? Once again, driving that aspect of even those clients who do not necessarily need to pay for a decryption tool may still consider engaging with the attacker in order to stop the doxing efforts or the posting on their websites publicly.
Yeah. So, Tom, you've served as a CISO. You've got a lot of experience in this area, trying to drive the good decision making within the organization. Based upon, again, recent studies, 46% of CISOs surveyed said that ransomware represents the biggest cybersecurity threat. Is that what keeps you up at night? And what have you done, holistically speaking, to get an organization sensitized to this threat landscape and prepared to address a cyber attack?
So Karen, I think ensuring that you've got senior leadership and more board support is key. Education effort in terms of letting them know what the risk is to the organization. And one thing that we haven't really talked cybersecurity or information security, the basic triad is confidentiality, integrity, and availability. We pretty much focus on the confidentiality piece, but I think we fail sometimes to look at availability, especially for a hospital. If you've got someone there that's got ransomware and they have your data, it's one thing. But if you have them being able to impact your operations, where you're no longer being able to conduct both elective and non-elective surgeries and procedures. That's a whole nother game for the medical devices, especially blood pressure cuffs. The amount of digital equipment in a hospital and even in people's homes is overwhelming. So again, having the conversation and framing it around risk is the best way to try and ensure that senior leadership and boards understand. Everybody can be Henny Penny, anybody can be Chicken Little and go and say the sky is falling. But if you can frame it in a risk discussion, it's much better received, and your chances of getting funding and support are that much stronger.
Yeah, I think the curse is trying to approach a board to discuss technology or to discuss the importance of cyber risk and mitigation measures, by mentioning, IT. I think if you address it in a business way, you may get their attention and response a lot faster. Is that what you found, Tom?
Yes, Karen, that's exactly what we found.
Okay. So this is just a list, and I'm sure Tom in his head is checking off every one of them. One of the things I wanted just to explore with you, Tom, because I find it very important, is preparing for a cyber attack by designating an incident response team, having a playbook for each type of attack in place, and conducting tabletop exercises. I'm sure you've done that in the past. Going into the tabletop exercises, did you find that your team members felt comfortable going through it, were prepared, came out with shining colors, or did you find that there was a pretty big learning curve that needed to be evaluated and re-explored later?
Karen, what we found out was that we performed miserably. So we showed up for the tabletop exercise. Everybody was there. Nobody had read the playbook. Nobody had practiced it. So you can imagine, in any sports analogy, showing up at the game, everybody kind of knows how to win the game, but the tactics and working together was not practiced. That was very key. So yes, I would agree. Having an incident response team clearly designated before your incident, being able to have playbooks for the primary attack vectors, and then practicing. Practice doesn't make perfect, practice makes permanent. And if you practice and practice and practice, when you have to really do it, you're much better prepared, just like the team at the fire department.
Right. And so usually how many different types of playbooks are included in an incident response plan?
For our group, we had 5. There is a group, Karen, nationally called HC3. I think the 3 H is for healthcare, and the C is Cyber Coordinating Council. They've identified for the medical community and the healthcare community 5 primary attack mechanisms: ransomware, phishing, malware of some other sort, data loss, and medical devices. Now, in my previous job, I did not have to worry about medical devices. I didn't work for a hospital, but that's a whole nother ballgame, especially when we bring life safety into the discussion.
And I think that's what, definitely differentiates you between, with other people, the patient safety, their lives. People forget that, when it comes down to healthcare, they look at it the same way as other organizations until they really realize that a life could be lost. I think there was a ransomware attack that ended up having an ambulance rerouted with a patient in it, and that patient ended up dying. So it does have certainly a discussion that needs to be had with that incident response team, and making it part of the playbook. I mean, obviously, all of these things that we're doing is not just to address cyber risk, but from an attorney's point of view, it certainly puts everyone in a very different defensive position if you're prepared to address one of these cyber attacks. The first 72 hours is the most crucial. It really is. And if any of you on this call has been involved in a business email compromise or any other type of compromise where time is of the essence, you understand why the first 72 hours is crucial. Most importantly, it helps to contain the intrusion before it could potentially move laterally. Jason, how many times have you received a call from a breach coach or from a client directly to talk about an incident that they think they've had, and they let you know that they're just getting in touch with you because this happened 2 or 3 weeks ago?
The 2 or 3 weeks ago definitely happens. It's much more frequent that we are engaged a lot quicker than that. And to your point of the 72 hours, it is critical to start understanding what's going on, data preservation, really how to handle it. When you start getting to that 2-3 week time frame, especially from the forensic investigations part, you're starting to talk about logs rolling over. You're starting to talk about data availability, as well as we talk about, earlier, the ticking clock aspect to it if we need to engage with the attacker. All those things come into play when we start extending the timeline to it. So definitely from the onset, being able to understand what has occurred, what is potentially impacted, working with your insurance carrier, counsel, and a forensic provider to really give proper guidance is going to be very critical.
Yeah. Have you run into a lot of situations, because this one drives me crazy, where a client goes to you first and they want you to start a forensic investigation without including counsel on it? I mean, I would imagine that makes you somewhat nervous because both you and I know the importance of having a breach coach involved for the attorney-client privilege purpose.
Yeah, and it does happen. I definitely love working with people such as yourself, Karen. Not only does it preserve that privileged and confidential discussion, but people like yourself and others can also help guide and provide the information necessary to understand the risk level and obligations that are tied into what's going on with it. So definitely we would always encourage counsel being involved in any discussion that we are a part of, but it does happen.
Right, right. So let's move through. I said to Nick and Tony, I hate to do these programs for an hour because everyone on this call could be speaking about these issues probably for a half a day. So we're gonna move a little bit quicker so that we can get everything in. These are just very preliminary steps to follow with regard to responding to a ransomware attack, getting that team together, containing and eradicating with the help of your IT, your team, with forensics, determining the scope of the compromise and the encryption, and finally determining the strain of the ransomware. And sometimes you can share that with forensics pretty quickly, right, Jason?
That is correct.
Okay. So do you want to let them know what they should be looking for? Maybe their IT can spot it so that when we jump on a call with you, it will give us a head start on how to address this type of attack.
Yeah, some important things for us to start understanding are what indicators of compromise occurred prior to the ransomware incident, obviously what data is at risk within it, and understanding if there's any privileged credentials that have been compromised as a result of it. Starting to, as we get on that scoping call and discuss short-term remediation, things as simple as password resets, disabling RDP, those are all discussions which are going to be critical to helping mitigate the risk right there on the spot, as we are then able to set up different programs and start the forensic investigation.
Yeah. And just on that note, I find that the people who understand their infrastructure and have a strong infrastructure usually have a better result. Knowing where your data is, where is it, what servers is. We've had cases where they have no idea which end is up, and it really delays the response effort, which down the road could have an impact on you with regard to your legal, ethical, operational, and reputational harm. So you heard us talk about scope and strain. And once we get a handle on all of this, your breach coach and forensics and your internal team, we start talking about options with regard to responding to the ransom demand. Do you want to restore files from a backup? Do you want to try to decrypt? Do you want to do nothing and lose the data? If you find the data could be just meeting minutes, something that's very benign, then it's, going further may not be of interest to you. And then finally, the most important response that we're going to dive into a little bit is negotiate and or pay the ransom. So these are some of the discussions that we have. This slide reflects an actual discussion with the threat actor. It's a sample negotiation, so you can get a feel. Jason, do you want to just address what gets set up? People hear about a ransom demand. They think there's a nice gentleman in the back room with a wallet that's going to, pay out the ransom, but it's more of a process that's dealt with if the decision is made to move along and pay. Sometimes you all will engage with a negotiator just to find out what they're looking for. Maybe not to really take seriously the payment of a ransom, but sometimes you reach out to find out what they're looking for. All depending, holistically speaking, what data is locked down, whether or not you want it back. Would you like to address that, Jason?
Yeah, very much so. Nowadays, we're also seeing the advancement of these attackers using a Tor portal and a chat communication avenue. Others are still using email. So there's also different ways we can engage and communicate with them. Karen, to your point of how these discussions go, obviously the decision to make a payment is a business decision that has to be a weighted effort with essentially everyone involved in that discussion. In this example that you see here, 11 Bitcoin, it's very normal to pay in cryptocurrencies. And Karen, to what you were saying, we do have many discussions with clients as we start these engagements and start talking to the attacker. The business decision to make a payment has to be heavily weighted. A ransom demand that is $25,000 for a company to get the decryptor and be operational to some degree in 24, 48 hours may be an easy decision in comparison to a $3-4 million demand that's out there, and they've possibly exfiltrated the data that we've discussed. So these are all the pieces that kind of have to be put together to understand the risk and the reward to a payment for any client, obviously weighing in the counsel's decision on what data is at risk, as well as your insurance coverage from people like Kelly on that one.
And again, very, very important to take that holistic approach, and you don't take it at the time that the ransom demand comes in. This is something that you talk about in detail with your key stakeholders when putting together your plan, when putting together a strategy of what will you do if you're attacked. So none of these discussions should come as a surprise. You don't want someone sitting around the table trying to figure out whether or not to pay a ransom and then have someone say, what do you mean there's an OFAC advisory out there? And then start hearing about sanction groups and what happens if you pay them. These are just a couple of considerations. It's certainly not all inclusive, but these are things that you talk about in advance, not at the time of the attack. I mentioned OFAC, something I'm sure that Tom has been alerted to. I know Kelly is very much on top of what's going on with OFAC because it's driving in some ways and in part the insurance industry. And so just in a nutshell, OFAC came around. They issued an advisory in October. This was not a new advisory. It was not something new, but because of the number and serious nature of the ransomware attacks, they wanted to remind people that some of these ransomware attacks may be having an impact on our country's national security. If you take a look at the countries, China, Russia, Iran, Nigeria, and others, they wanted to remind people that if you engage with the victim of a ransomware attack and you pay a ransom to a sanctioned group, you may be facing some pretty stiff penalties. And this was directed to the cyber insurance industry, digital forensics, and incident response, as well as financial service providers. The civil penalties for sanctions are based upon strict liability. And on the other hand, they do encourage your cooperation with law enforcement. To date, I know of no enforcement based upon this advisory? I don't know, Kelly, have you heard of anyone going after someone who may have paid a ransom to a sanctioned group?
I have not, but we have seen situations. Well, we have at least one situation where a ransom was paid by a policyholder, and there was probably a 30-day delay between when the policyholder paid the ransom, and they sought reimbursement from their insurance carrier. When they sought reimbursement from the insurance carrier, and the insurance carrier did an OFAC check, the cyber criminal gang had been added to the OFAC list in the interim. So when the payment was made by the policyholder, it was not a violation of OFAC, presumably. However, for the insurance carrier to then respond and reimburse became problematic. And so the insurance carrier's position was they could seek an exemption from OFAC, and I believe that's what is going on right now. They're attempting to do that.
Yeah, I think OFAC and the Department of Justice, depending upon the case and the facts, I think in some ways they are willing to work with companies and individuals. They are trying to encourage cooperation with law enforcement. They're trying to collect this intel and use it to educate companies and individuals on the risk and how to reduce it. But I know that they will consider a consent order, enter into that with you. But again, these are very serious decisions that you all need to make, things that should be discussed very early on, a strategy that you should have in place, the what if you find that a sanctioned group may be included. And Kelly's right, these sanctioned groups are added on a daily basis. So it really can change and you can get caught in between. Right. Notification. We talked about responding. We talked about the importance of forensics. How do you respond to a ransomware attack? If we find that there has been access or exfiltration or publication of sensitive protected information, then you have to go into another step, which includes notification. One of the things I wanted to ask Jason, because we had this discussion before, was sometimes a journalist will come to a client and say, guess what, I just saw all of your information out on the wall of shame. What are you going to do about it? And the insured, the client, knows nothing about it. Or law enforcement may come knocking on your door because there's been a third-party vendor breach that could have affected you. Who sees that information? Jason, Kelly, Tom, on the wall of shame. A lot of people will say, well, who's seeing it? Can I see it? Can I go look? Who would like to comment?
Yeah, I can jump in on the beginning part of that. So these walls of shame, the doxing websites, are definitely very public in that sense that if you know the website and you know how to get on a Tor browser, you can definitely access them. And that's what the attackers actually want, right? The more people that they post up there, the more data. It validates that the next victim may look at that and take it into more careful consideration. That's also where we come in to also weigh, what is the likelihood this threat actor is what they're threatening, whether it be exfiltration or, like Kelly said, contacting their people. How valid do we think that threat is? So it's definitely a risk out there, and we do have plenty of clients who, once their name is posted, they are being contacted or it's being tweeted about that they were out there.
Yeah, and I think with regard to the publication of information, it's interesting, and it gets back to understanding your data, know where it is, how much do you have, because sometimes you'll see data dumps on these wall of shame once, twice, 3 times. I think the other issue, quite frankly, is the non-protected information. I had a case where they found out that information was published and they really weren't concerned about it. They didn't want to do anything about it. It wasn't protected information. But then there was a second data dump, and I received a call right away, and they wanted to talk about getting that suppressed or taken down. They had the backup, but the information had already been stolen, and this was very embarrassing. It had to do with, sexual harassment lawsuits, their trial strategy. And, a lot of people take the position that we're not going to pay to suppress data because most of the time it's not going to be suppressed or it's already been sold off to a third party. Again, decision making that has to be made well in advance. This just gives you a roadmap to notification. Unfortunately, we do not have a uniform federal privacy law. There are 50 states out there with different laws. The security breach laws change on a daily basis. I just gave you an example with regard to personally identifiable information, now including biometric information. No consistencies. Sometimes in New Jersey, if we're going to roll out notification to a consumer, we have to notify the state police first before we can roll out the consumer letter. Some people, actually some states, including Massachusetts, want a representation that you had a written information security program in place at the time of the incident. So again, holistically speaking, the response effort, it rolls into notification if we find that data is at risk, and we roll out the notification. Keep in mind that in addition to looking at the breach statutes, we look at contracts. You all should be aware of the contracts that you have with vendors to see if they have any breach notification requirements in them, and then obviously regulatory requirements as well. A ransomware attack is considered a breach under the Health Insurance Portability and Accountability Act, unless you can show that there's a low probability that the PHI has been compromised based upon a risk assessment involving 4 factors, and I've listed them there for you. So again, strategy in deciding whether or not notification is required. So Jason and Tom and Kelly, I'm sure you all look for it when you get insurance applications in. If someone has suffered an incident or breach or gone through incident response, how important is it not to stop after the response, but to take one further step to evaluate lessons learned?
Well, I think from an insurance standpoint, it's definitely very important, right? The insurance carriers are certainly looking to see that you have learned, in fact, from the incident, and that you are implementing various controls or procedures in place to sort of prevent the same thing from happening again. And I think certainly insurance underwriters today are very, very sensitive to that with respect to ransomware specifically.
And Karen, I can share a personal experience in that we filed a claim about a year and a half ago, and it ended up not following through. It was a misconfiguration versus an actual breach. But when it came time to renew, we had to provide a couple paragraphs, if not a page worth of explanation as to how we were working to ensure that those configurations were not reoccurring.
Right, right. And I think sometimes in the notification letters, we may even throw a paragraph in there about, what's been, what happened and what did you do about it? And sometimes we'll put something in that letter. But you're right, Tom and Kelly, it's very important. And I think, and Kelly's going to address the insurance market shortly, but I think there are cyber liability applications being sent out by carriers, and now even supplemental applications just for ransomware alone. Is that right, Kelly?
That is correct. That's what's happening today. It's all about ransomware.
I'm going to hand the insurance over to you in 1 second, but I just want to mention the HIPAA Safe Harbor bill. It is a good incentivizing bill. They've asked, people who are evaluating incidences to consider whether or not best practices were in place when considering fines or the length of audits. So this should help a lot of people make the good decisions to have proper security and best practices in place, knowing that this will or may be available to you should you suffer an incident. So now, Kelly, we're going to transfer the risk over there to you. Everyone on this call, definitely, and we're not selling things. This is something that is the first question I usually ask my clients when I get the call. Do you have cyber liability insurance? And when they say yes, I'm relieved. When they say no, I feel like saying to them, buckle up because you're in for a ride. So Kelly, tell us about how ransomware attacks may have impacted the cyber liability insurance market.
Sure. So the frequency, severity, and complexity of ransomware attacks that we've all been talking about for the past, 40 minutes or so, has had a very significant impact on the cyber insurance market in a very short period of time. So, up until probably about 2 months ago or so, the cyber insurance market was pretty good. There was a lot of capacity, a lot of players. The price was relatively reasonable in terms of what you were getting. Underwriting was pretty, basic. You could get a quote for very little information. And I think that, what has happened over the last, say, 12 to 18 months with respect to ransomware is absolutely having an impact on the market today. So today we are seeing, premium increases anywhere from 25 to 50% or more. We recently had an increase of 124% at renewal on an account of ours. Retentions, deductibles are increasing. They're either doubling or tripling sometimes. We're seeing capacity constricting. So we're seeing markets come down from, let's say they gave you $10 million in limit last year, they may only give you 5 this year. There's, the competition is just sort of tightening up. The coverage is tightening. We're definitively in a hard market. We are seeing, as Karen mentioned, the introduction of ransomware supplements. We are seeing much more enhanced, sophisticated underwriting as a general proposition. The markets are looking for more information. I think at this point, probably every cyber insurance market has introduced their own ransomware supplement. And, they're all a little bit different. We're also seeing the carriers rely a lot more heavily on security scans for underwriting purposes, and add various subjectivities based on whatever the scan reveals. We are seeing the introduction of coinsurance associated with ransomware or cyber extortion coverage. So it used to be that you would just get, if you had a $10 million policy, you had available to you $10 million for cyber extortion or ransomware. Today, that is either going to be sublimited or you may be subject to some sort of coinsurance. It may be a 50-50 coinsurance. I think most of what I'm seeing is 75-25, but I have seen some 50-50. So, the markets are definitively tightening up and responding to what we've all seen in the last 18 months or so with respect to ransomware. The other thing that we have seen recently that's sort of interesting is the SolarWinds exclusion. So underwriters are asking questions about the SolarWinds incident and whether or not you think you may have been impacted or have the potential to be impacted. If you cannot say definitively no, you may find yourself with a SolarWinds exclusion on the policy.
And that's interesting because I don't think a lot of people really know how far that's going to go even today.
And I think that's why the markets are being so careful.
Right. And Karen, as a practitioner, I can share with everyone that everything that Kelly just said, my broker told me about 60 days ago. Count on increased premiums, increased deductibles, caps and limits, co-insurance. If you've answered a 50-question survey before, count on it going to 150. Your ability to prove that you are insurable is going to go up. And so having vulnerability scans and penetration tests and incident response plans will at some point hopefully drive your premiums down because you will be able to demonstrate that you are a cyber safe business.
Well, I think we've even seen non-renewals for entities that cannot say that they have multi-factor authentication across the board. I think multi-factor authentication in particular, I think will become, or may become in the near future, a couple weeks from now, perhaps, one of those determining factors. You may not be insurable at all if you can't say that you have that across the board.
Yeah, and rightfully so, really.
Yeah.
I mean, you know, the good news is these applications will force you to consider and adapt best practices. The time is gone that you know, you can stick your head in the sand and think, as that engineering company did, that, you know, they don't have the crown jewel, so they're not going to be targeted. Back to Kelly and Tom's point, best practices to consider, and I know Jason is nodding his head as well, but in addition to multi-factor authentication, I think endpoint monitoring has become very important, along with everything else. I can't rule anything off of this list. Patch management. Jason, Tom, Kelly, anything on this list that you want to highlight? Kelly's already highlighted the multi-factor authentication, endpoint monitoring. Go ahead.
Yeah, they're all questions that are now being asked very specifically. Even on some of these will appear on your basic application. Some will appear on the ransomware supplement.
Well, having the right team to fill out those applications, I think, is extremely important. I'm hoping the days are gone where someone is, you know, called out of the hallway and asked to, you know, fill out this piece of paper. You really need to have the right team involved, who has an understanding of the security practices, of the network, of your hardware, your software that you should be keeping an inventory on anyway. So you don't want to be in a position where you're misrepresenting or providing bad information to the carrier, because you know, could have an impact on coverage on later on. So I always recommend to people to have counsel involved with these applications. Do whatever you can to protect the confidentiality of some of these applications. If you're not getting a cyber liability application, you may be getting an information security questionnaire from clients as well, because they are vetting their third parties. This is about vetting and managing third-party vendors. This slide is to transfer risk. I thought it was interesting that it looks like for the healthcare industry, business associates were largely to blame for 2020 data breaches against healthcare organizations. Those would be people in insurance. Those would be people in billing. So make sure you know who you're doing business with. You have the appropriate agreement in place that transfers the risk, that requires that they cooperate during an incident. That, you know, so there is a good checklist to use. The ABA is now currently putting together a vendor checklist. It hasn't been finalized yet, but I've been working on that, and it's going to be excellent for people to use to vet third-party vendors. I also like to mention CISA. Tom knows them very well. Tom and I actually serve on a task force together at a law school, and we have members of CISA on our task force, and they are just excellent, working day and night to protect organizations and individuals against cyber attacks, but specifically ransomware attacks. So I would highly recommend that you go to their resource page and take a look at some of their publications. I do it on a daily basis, quite frankly, because that's how often they update it. My final thought, if you're not doing scans and penetration testing like Tom recommends, then just know that someone else is, and they don't work for you. So keep that in mind, and we'll open it up to some questions, keeping in mind the 1 hour limit.
Karen, we have a question that came in. What liability does SaaS providers share in this environment?
I'm sorry, you broke up there. Is that Tony?
Yes, it was me.
Okay, so I'm sorry. Could you repeat that question?
Sure. What liability does SaaS, SaaS providers share in this environment?
Well, you know, we're getting into third-party management. Again, you know, you take a look at the contract. You take a look at, what data they're holding on to, how the incident occurred, and then everyone ends up pointing the finger at each other in terms of, how did the compromise take place? What was lost? What did the contract provide? And, I find with regard to third-party vendors that they usually take charge of their own mistakes or in the response effort. And assuming that they have insurance, they pay for notification and anything else that flows from the incident. But there are times that they may not, especially if they don't have insurance. So that's just generally speaking. Kelly, I don't know if you have any thoughts, or Tom, or even Jason, with regard to liability.
I've seen damage caps in the contracts. So I think sometimes that can be problematic because they do wield a fair amount of power, if you're going to use them. But yeah, and I think that from an insurance perspective, it'll be interesting to see how expensive their insurance becomes in this market, and whether or not they can either maintain, sustain the level of insurance maybe that they had in the past. So be interesting to watch that.
And Karen, I would volunteer that are really good responsibility matrices out there that take a look at software as a service, infrastructure as a service, platform as a service, that very clearly differentiate what responsibility it is of yours as the owner of that data, and what responsibility that your third parties providers of those services have. And those are really good differentiators in terms of knowing, on-prem, you own it all. Once it goes to the cloud, then it's a shared responsibility model. And it's different at each of those different levels, and knowing which one that you're actually consuming, whether it's infrastructure, platform, or software, is key in understanding what your responsibility share is.
Yeah, that's an excellent point, and something that everyone should have when they're putting together contracts. So there's a clear understanding of responsibility. Tony, anything else?
Don't see any other questions that come through, and we're right near the top of the hour. So I'd like to say thank you to you and to your group for a great presentation. And anybody who is on the call, we will have this recording posted up on our website and our YouTube page within the next 48 hours. So anybody, if couldn't make it and you know somebody that wanted to hear about it, pass the message on and we'll have them come on. Karen and crew, thank you very much. Great job. I appreciate you folks joining us.
Certainly, and thanks to Jason, Tom, and Kelly. Really appreciate your insight and your expertise.
Thank you for
Last
having
note,
us.
if anybody is interested, we have 2 other meetings coming up this month on the 23rd and the 26th. Please look at our website. Come and join us for those virtual meetings as well. One on diversity, and the other is on compliance and interoperability. Thanks again, everybody. Have a great day.
All right. Thanks, everyone.
Thank you very much. Right.
Okay.
Bye-bye.
Bye, everybody.
Thanks again, Jason.